Hey, everybody, welcome. We've been trying to answer a lot of these questions concerning coronavirus. Here in Georgia, the governor's signing a bill today to force us to shelter in place. I hate using that. Using that during wars was a crucial factor. It's a little bit extreme now, but I understand it's an extreme situation. So, since COVID 19 or the coronavirus seems to be sparing children, the question is why? What is it that makes it different? Can we learn something from there? Or if you have children at home right now, is there anything that you have to worry about concerning them? So we're going to get involved with this. This is from the University of Virginia Health System. Hopefully, again, in this whole stream of things concerning the coronavirus, you learn something. Although COVID 19 so far appears to be largely sparing children, researchers are cautioning that it's critical to understand how the virus affects kids to model the pandemic accurately, limit the disease's spread, and ensure the youngest patients get the care they need. The warnings come from Stephen Zeitcher, the head of University of Virginia Health Division of Pediatric Infectious Disease, a pediatric emergency medicine physician at Houston's Baylor College of Medicine. They have authored a commentary in the Journal of Pediatrics, very traditional journal, accompanying a new article that reveals a small percentage of infected children become seriously ill. Those at greatest risk include babies and preschoolers. This is the first that I've actually heard of this. Most infectious diseases affect children differently than adults, and understanding those differences can yield important insights. This will likely be true for COVID 19 just as it was for older infectious disease. Dr. Zeitcher and Cruz note that there are subgroups of children who appear to be at greater risk of COVID 19 complications, particularly those who are younger, one, immunocompromised, two, or have other pulmonary health problems. Now, this is intriguing to me because still the number one reason for preschoolers to go to their pediatrician is for asthma, pulmonary health issues. However, the presence of other viral infections is up to 2/3 of childhood coronaviruses, makes it very difficult to assess the true effect of COVID 19 on children, they state. While much remains unknown, Dr. Cruz and Zeitcher caution that children, even asymptomatic children, could play a major role in disease transmission. This is what you're hearing on the news. For example, they cite a study that found the virus remained in children's stool for several weeks after diagnosis. This thing stayed in the body and could be found by a DNA analysis of stool. That, combined with other routes of transmission, such as nasal secretion, could pose a major challenge for schools, daycare centers, and children's families. Think about this, because I remember when my daughter sent my granddaughter to daycare while she was still in diapers, that the daycare workers had a supply of diapers on hand. And part of their job was to help potty train these kids and change their diapers. Who would ever think that that's a route of transmission? Since many children infected with COVID 19 appear to have mild symptoms or even no symptoms at all, it's important to practice all the social distancing, hygiene, and other precautions they recommended by public health authorities. How do you keep a preschooler in this world? You keep them home. This is another in that line. Teaching kids right now to wash their hands thoroughly. And again, to minimize transmission from children to others, including family members who may be at a greater risk from the infection, such as grandparents or family members with chronic medical conditions. Said Zeitcher is working on an innovative potential COVID 19 vaccine in their labs. In addition, studies of the reasons why children are affected differently than adults by the infection may yield insights that can be helpful in understanding the disease and ways to treat or prevent it. They still don't know. They still don't know. Part 2 of this from the American Thoracic Society says researchers have found that half the patients they treated for mild coronavirus infection still had coronavirus up to 8 days after the symptoms disappeared. In a new study, researchers found that half of the patients they treated for coronavirus infection still had coronavirus up to 8 days after the symptoms disappeared, which is why they're even being told, because just recently my sister's son, who's an emergency room nurse, was just diagnosed yesterday. Mild symptoms so far. We don't know how long he's had it. His fever started about a week ago. In this article wrote called Times Kinetic and Viral Clearance, they say the patients that were treated and released from the treatment center of the General Hospital of Beijing between January 28th and February 9th, patients had a median age of 35.5. Researchers collected samples from throat swabs taken from all patients on alternate days and analyzed. Patients were discharged after the recovery and confirmation of negative viral status. The most significant findings from our study is half the patients kept shedding the virus even after resolution of all their symptoms. The primary symptoms that these patients had included fever, cough, pain in the pharynx, and difficulty or labored breathing. Patients were treated with a range of medications. The time from infection to onset of symptoms incubation period was 5 days among all but one patient. The average duration of symptoms was 8 days, while the length of time patients remained contagious after the end of their symptoms ranged from 1 to 8 days. 2 patients had diabetes, 1 had tuberculosis, neither of which affected the timing or the course of the COVID-19 infection. Ironically, as it's been stated, diabetics are at a much higher risk. If you had mild respiratory symptoms from coronavirus and were staying at home so as not to infect people, extend your quarantine for another 2 weeks after recovery to ensure that you don't infect other people. The authors had a special message for the medical community. COVID-19 patients can be infectious even after their symptomatic recovery, so treat the asymptomatic, recently recovered patients as carefully as symptomatic patients. The researchers emphasized that all these patients had milder infections and recovered from the disease, and that the study looked at smaller numbers of patients. They noted that it's unclear whether similar results would hold true for more vulnerable patients. Tomorrow on the show, a possible treatment for coronavirus. It's now coming in. You see it on the news every day. So we're going to take a look at that and much, much more. If you have questions, comments this Saturday, once again, I'm going to open up Facebook Live at 10 o'clock Eastern for any questions you might have. Not that I have every answer, but I'm going to attempt to answer those as best we can. Whatever's on your mind. Give us a call here at the office at 678-228-8900, 678-228-8900. We'll talk to you tomorrow. God bless you, folks. See you soon.